So what is minimal invasive spine surgery or endoscopic spine surgery, like they say laser spine surgery, and what are its advantages? So minimal invasive spine surgery or endoscopic spine surgery are the surgeries where the access to the disc or the site is taken through a keyhole, or there is less muscle dissection, like in an open conventional approach where you open, where earlier people used to take a big incision and open, do an open surgery. Nowadays we don't do that. We take small incisions. It is a very small centimeter, 1 or 2 centimeter keyhole incisions we take, and through that we go and perform the surgeries. First advantage is it is minimal, that is the cosmesis part, or it is the incisions are very less, the scar is very less, it is cosmetically better. Second, the muscle dissection is not there. We go through the muscles and the muscles are retracted and they fall back again. Third is pain after surgery is less. The pain when you experience after surgery, when you have a big surgery, is far more than what we do in endoscopy or minimal invasive surgery. The blood loss is very minimal, or you can say negligible. The infection rate is negligible. The approach what we go through the back for the disc is minimal, as in we have targeted approach. For removing a disc at one level, we don't open the whole thing, we just go targeted. We have machines from which we see it and we target the disc and we remove it. Then advantage is that you can go back home, shorter hospitalization stay, matlab you can go back home very early, like I said, same day also we discharge patient, or we discharge patient the next day also, and you can get back to work immediately, like after spine surgery in 2 or 3 days, or depending upon the surgery, you can go back to the work earlier than before, like an open surgery. So these are the advantage. So minimal invasive spine surgeries are always better than open spine surgeries, and these are recent and advanced techniques. So how safe are the spine surgeries? People who have spine problems are usually the first big myth in them is like, oh, we have to undergo a spine surgery. They are already in a frame of mind where they'll not be able to get up from bed, or they'll be bedridden forever, or they'll not perform certain activities. So let us know today how safe is spine surgery in today's world. So let me tell you, now spine surgeries recent times are very advanced. Do spine surgeries in daycare also now. You can get back to work, or you can go back home the same day, and without any pain, and the pain will be gone in single or day. So these are the recent spine advances in spine. How safe are spine surgeries? Spine surgeries are very safe. In lumbar spine, if you call it slip disc or something, then the risk is very negligible or very minimal. The risk of having blood loss, infection, scar cosmetically has also gone down because it is endoscopically, or let's say minimal invasively done. If the surgeries are bigger surgeries like a cervical surgery or a TB spine infection, if it's a myelopathy, if there is something else, the risk will be told to you by your surgeon pre-operatively or beforehand. Other than that, if you have a normal condition like a slip disc or a listhesis, the risk of spine surgery is negligible or minimum. You can perform spine surgery and get back to work easily. There is no like people are worried about if they will not be able to work or perform any activities after surgery. It is not like that. You can perform major or most of the activities after spine surgery. So what is daycare procedure or daycare spine surgery? So daycare procedure is one where patient comes to us in the morning, we operate him and we send him home the same day. It is usually done in injections, for biopsies, and majorly for slip disc. Slip disc patient comes to us, he has radiating pain to the leg, he has radiating pain, excruciating pain, he comes, we take him to operation theatre in local anesthesia or spinal anesthesia, we remove the disc, the patient is pain free, and by end of the day he is walking and he can be discharged and gone home. So these procedures which are done in a daycare manner are called as daycare spine surgeries. What is awake spine surgery? So awake spine surgeries are the surgeries where when you are taken to operation theatre, we don't give you general anesthesia, or we don't give you complete anesthesia. The only local part where we are performing surgeries in your back are given anesthesia, or spinal anesthesia is given, which is below the lower limbs are anesthetized in that case. in which you are awake and you are seeing everything, and you are talking to our anesthetist or my colleagues or someone, and you can be seeing everything on the screen also what we are performing. You will not be given complete anesthesia. So if you are scared of complete anesthesia, we can perform the surgeries in awake spine surgeries, which are called awake spine surgeries, and these are the recent form and recent advances in spine surgeries.